Welcome back. The U.S. missed President Joe Biden's goal of getting 70% of adults vaccinated by July 4th. The country at 67% with at least that first dose. Wisconsin at 66%. This as the Delta variant of the virus is becoming more prominent. We're joined live now by Dr. Jeff Potoff from UW Health. Doctor, good to see you again. We're almost 3 weeks now where our 7-day average of new daily cases in Wisconsin is below 100. Especially now, though, coming off the busy travel and gathering weekend. How confident are you that we'll keep numbers at that level?
Yeah, I think we're in pretty good shape for those numbers. We could see a small spike contributed by areas that are in the state that are less vaccinated, that people potentially got infected during the holiday weekend. But because there are a fair number of people who are vaccinated, those big spikes that we saw, say, last fall, likely not to see anything like that.
We're talking with Dr. Jeff Potoff of UW Health. Doctor, turning our focus to the vaccines now, you and I have covered this ground before, but I do think it's an important point that I'd like you to address again. With the vaccine now widely available to anyone over 12 who wants one, what concern is it really to someone who is vaccinated, whether anyone else chooses to get vaccinated?
If you're fully vaccinated, your risk at this point is really low. You're unlikely to have severe disease or end up in a hospital with COVID-19. But the stickler on that is if we don't get the pandemic under control, we give this virus more opportunity to mutate. And if it creates a variant that defeats our current immunity from the vaccine, then we all start over, vaccinated people included. They'll need to go out and get a booster dose to account for that. So it's all in our best interest to just stomp this thing out, not keep giving it chances to do more damage to us.
On the vaccines, too, we're now starting to hear that people who got the Johnson & Johnson one-shot vaccine could possibly need a booster shot in the future. Do you have thoughts on that and whether that could be a mix and match shot, or will these folks need to get another J&J if that's the one that you got the first time?
Yeah, I think when we talk about booster doses, if there's more than one available, I think it will be reasonable to get kind of whichever one you can get, whether it's J&J or something else. I do think boosters will be needed in the future. The question that is really hard to answer is when. Given the technology used, Johnson & Johnson probably before the Moderna and Pfizer. But, when exactly that will need to be done is still a bit of an uncertainty.
It's Dr. Jeff Potoff of UW Health. Doctor, great to see you again. Appreciate your time as always.
Thank you.
And we have expanded coverage on the pandemic, including information about how to get vaccinated up at tmj4.com/coronavirus.